Thank you for coming. I appreciate it. What I'd like to talk with you a little bit about is the issue of investments. You mentioned investments. Almost every constituent that comes to see me in my office talks about the need for additional funding, for example, for the NIH, for Alzheimer's research, for cancer research, MS, diabetes. They may talk about education. They may talk about some other program that is funded by discretionary spending. And a lot of times when people mention investments, that's what they're talking about. And I have supported increasing NIH research funding. I wish we had the money to increase it drastically. But the reality is that funding is getting pressured, squeezed out by the growth of entitlement spending. If you could look, I've got a slide here. So this is something that President Obama said in 2011. If you look at the numbers, Medicare in particular will run out of money, and we will not be able to sustain that program no matter how much taxes go up. I mean, it's not an option for us to just sit by and do nothing. Next slide. This is what I call the Pac-Man problem. I use this to explain to folks who come to visit me why the funding that they are in favor of, which often I favor, NIH funding, for example, why it's under pressure. And it's under pressure because the yellow part, which we recognize as Pac-Man, is continuing to close its mouth on all the stuff that you refer to as investments. And HHS Secretary, after HHS Secretary have talked, both administrations, Republican and Democrat, praised their budget as fixing the problem. But the problem persists. And I just invite you to work with us for real reform on Medicare to fix this. And I would welcome your comments on how your budget will address this problem.
Well, sir, I would welcome the opportunity to work on a serious, big budget deal, including entitlement reform, but also including tax reform and revenue sharing, and spread that equally across the board. I would say that the passage of the Affordable Care Act was one of the most significant issues of late to increase the solvency of the Medicare Trust Fund. The trustees put that passage at about a 12-year additional solvency. This budget adds an additional 5 years. So when this president came into office, Medicare was likely to go broke in 2017.
If you excuse me, I think I'm out.
That window has now been significantly extended, and this committee has voted 50 times to repeal those.
But you're robbing Peter to pay Paul, and the seniors are bearing that burden.
All right, time has expired. Mr.